We are at the Sound Symposium, arranged by the Sound Environment Centre at Lund University and Ecofon. And I'm standing here with Professor Kerstin Persson Waye from Gothenburg University. Welcome.
Thank you.
You just gave a very interesting presentation, and you went through an overview of the research so far in healthcare acoustics and sound environment. And it would be interesting to hear your conclusions from the findings so far.
Well, we can conclude that the sound environment at hospitals is unacceptably loud. And it seems to be the case that most disturbing sounds are the equipment, alarms, also conversation, activity sounds from the personnel. When it comes to a patient response, there's some data showing that the recovery period, sleep, is fragmented. But there is a need for more studies, better studies that connect the sound environment and patient response. However, that is very difficult to perform studies among very seriously sick people. As intensive care syndrome is a very serious outcome of being cared for at intensive care units, it's very important to reduce that risk. If we go to the personnel and how they are affected, there's even less data available. However, in the studies where one have intervened, have made the sound environment better, one can see improvements, for example, in personnel's attitude and how demanded they feel in their work. And also we can see in our intervention studies that if the sound environment is improved, then they also perceive it as clearly more comfortable and also as easier to communicate in.
And where are we with regards to sound awareness amongst healthcare staff today? Are we there yet?
No, I don't think we're there yet, and I think even more importantly, we're definitely not there when it comes to the people deciding on what type of equipment to buy or how to plan a hospital. They are the key people that we need to enlighten. And also I think it's important to enlighten the people who actually produce the equipment. What type of alarms do they have, the levels, how can it be altered not to disturb the patients and the personnel.
When you present data like this, you say that the ones building and planning the healthcare premises are very important in this process. What do they say when you present data like the ones you presented today?
I have very little experience with presenting data for that group. I haven't so far done that. It's been more wider groups, so it's not a relevant question. You can cut there. But I wish I could talk to them, yeah.
The Care for Sound is one of those, actually. We have a lot of functional planners and architects in the audience.
That's very good.
I think that your message may have reached that group, whether you were aware or not.
I think what one can say is that there is a much high interest for the topic worldwide these days. So I think it will also reach those decision-making people.
I hear your work is not done yet.
No.
Good luck in the future. Thank you so much for taking your time to speak to us.
Thank you.